Hi, I'm Skylar Adams, and this is my presentation for Nursing 4827. I chose my presentation to be about bullying at the bedside and methods for change. So, what is bullying at the bedside? To get started, bullying at the bedside can count as a lot of things, starting even in nursing school. So, it can go back as far as nursing school clinicals, and it can go into your everyday career once you graduate. It can be set in the clinical setting and noticed in leadership roles as well. Some nurses in the professional setting may count it as eating their young, per se. And throughout nursing school, students can definitely notice when a nurse does not want a student, and it can make learning difficult. Through personal experience and going to clinicals, I have personally noticed when a nurse does not want to work with a nursing student, and it can make learning that day very difficult. It can make the day very long, and it can also be kind of awkward. Bullying could count as sending a nurse into a bad situation, which counts as humiliation, favoritism, work overload, micromanaging, verbal criticism, and passive aggression. There are some more, but those were just a few to list. Background on bullying at the bedside. Nurses tend to leave their first job due to negative coworkers and bullying. According to our own worst enemies, the nurse bullying epidemic, Nursing Administration Quarterly, I found a couple statistics. So 78% of nursing students experience bullying in nursing school, and within their first 6 months, 60% of nurses leave their first job due to the behavior of their coworkers, and that can be very difficult considering you're excited to start your new job, you're a brand new nurse, and then you come in to find out that this is the way your workplace has been. It can be very disheartening. Younger nurses could criticize their elders' limitations. Older nurses may take advantage of younger inexperienced nurses. Males may bully females, and RNs may bully LPNs because of their job titles and what their scope of practice is. And that's just a couple examples. Leadership roles in bullying at the bedside and application. Hierarchical bullying can be seen as a lack of trust and support in your work environment. There can be inconsistencies, poor socialization in the workplace, and task conflicts. Bullying in the workplace also thrives in a negative environment that is justified by the leadership. For example, if the leadership uses fear and intimidation, it can show the staff that they can do the same as well. Leadership needs to have their own ways of leading and supporting the nurses that work under them. There needs to be a sense of trust so that if there is an issue that occurs, a nurse has the confidence to come to their leadership and know it can be addressed and the conflict can be fixed. Relevance and change. When a nurse is unhappy in their work environment, it can also decrease patient satisfaction rates and care. When a nurse is not happy, it can make the patient experience worse. So improving the nursing environment can bring up patient satisfaction. There are some things that could be done to help change this bullying epidemic at the bedside. Admitting there is a problem is the first step. Looking into the chain of command and where there is lack. Implementing a zero tolerance policy could be considered for bullying. And having a respectful work environment can change how bullying at the bedside is reprimanded, and it can improve patient care. These are a couple references that I used to create my slideshow, and I appreciate you watching. Thank you.